Hello, my name is Holly Sutterall, and today I'll be talking about the performance of Henrico Doctors Hospital in Richmond, Virginia. This presentation was organized as part of the requirements of HAP 725, a statistical process control course, and this is under the Health Informatics program at George Mason University. In order to do this case study, I used data from the CMS's hospital compare website. The years that I include in this case study were from 2009 to 2018. Before I talk about the case study, I wanted to give you guys a little bit of the limitations. There's a limitation that there's data that's not available all the years. When I stated that there's data between 2009 and 2018, there might be some performance indicators that do not have data in all those years. It might be only from a segment of those years. Also, it is possible that as more data become available, the conclusions that are reached today could change. Another limitation is no case mix adjusted, meaning that the data are not case mix adjusted, so there may not be changes reflected in the patient mix at different hospitals. It is possible that the hospital we are evaluating has received sicker patients in the years where outcomes fall outside of the control limits. Since the study focused on a convenient set of measures of quality, it is also possible that if we had selected other measures, the results and conclusions we have arrived could have been different. So this is a limitation where we are using selective measures. Additional, more comprehensive set of measures are available but were not used. Out of about 160 different measures, only 6 measures were used in this case study. Another limitation is that I used a 5% error rate, meaning that the control limits we used has a 95% confidence interval, meaning that in 100 observations, we expect that 5% of the data will randomly fall outside the control limits. When choosing the Henrico's Doctor Hospitals, I had to look at the different competitors around Richmond, Virginia. The competitors include the Medical College of Virginia Hospitals, the Bon Secours St. Mary's Hospital, and the CJW Medical Center. Before I go into explaining my data and charts, I want to give you a little tidbit. I use the X-bar control charts. These kind of control charts allow us to examine the average outcomes of care over time. They are built on the assumption that the average of observations have a normal distribution. So now I will go into looking at the different performance indicators in this case study. So the very first performance indicator I will talk about is the rate of complications for hip and knee replacement patients. So in this graph, you can see the control limits are in red, and the Henrico Doctors Hospital rate are in blue. So on the x-axis of this chart, it shows the data in which the rate of complications for hip knee replacement patients were available. On the y-axis, I showed that the hospital rates are within this quarter. As I say before, the red lines are the control limits. These limits were derived from variation of rate of complications for hip knee replacement patients across Richmond hospitals that compete with the Henrico's Doctors Hospital. As you can see, Henrico's Doctor Hospital has lower complication rates than its competitors from April 2013 to April 2014. The second indicator I use is the serious blood clots after surgery. This doesn't necessarily relate to all the hip and knee surgeries. It can mean any surgery performed at the hospital, but this could be an indicator as to if the patient would want to have their hip or knee replaced in the Henrico's Doctors Hospital. As you can see, the x-axis in this chart shows dates in which data was collected, and in the y-axis we show the hospital's serious blood clots after surgery. The red lines show the control limits, and these limits were derived from a variation of the rate of complications for serious blood clots after surgery across Richmond hospitals that compete with the Henrico's Doctors Hospital. From the graph, you can see that the Henrico Doctors Hospital has lower serious blood clot rates than its competitors from July 2014 to July 2016. The third performance indicator I used was looking at the rate that a wound that was split after surgery on the abdomen or pelvis. The x-axis is the date where the data was taken, and the y-axis corresponds with the rate of the wound that is splitting. And as previous, the red lines are the control limits, and the blue is the Henrico Doctors Hospital rate. As you can see, the Henrico Doctors Hospital started within the limits. Then in July 2013, it was above the limits. However, lower rates of wound splitting after surgery are seen in recent time periods. For the fourth performance indicator, I chose looking at the number of deaths among patients with serious but treatable complications after surgery. From this graph, you can see that most of the data with Henrico Doctors Hospital and its competitors do not differ very much. However, if you can see the very first time frame in July 2010, Henrico's Doctors Hospital was below the limits. For the performance indicator number 5, I use the rate of MRSA infections. So on the x-axis is the dates where the data were available. On the y-axis, I showed that the rates of healthcare-related methicillin-resistant Staphylococcus aureus, or MRSA infections. The two red lines show the upper and lower control limits. You can see here that the Henrico's Doctors Hospital's competitors do not differ much in the rate of MRSA infections, except for the 5th time period that was collected in April 2014, while MRSA infections were lower than the other Richmond hospitals. And the last performance indicator that I chose was the Clostridium difficile, or C. diff infection rate. As you can see, the Henrico Doctors Hospital and its competitors did not differ since Henrico's Doctors Hospital C. diff infection rates were within the limits. Before I talk about the summary of results, I want to reiterate that all the graphs that you've seen, if you see a value that is outside of the lower upper control limit, this could be significant, and that is a non-chance deviation from the expected values. This tells us that that specific data in that time period is not within expectations, and it may not be of a random chance, and that it needs to be looked at. So in conclusion, the Henrico's Doctors Hospital is better than its competitors in the rate of complications for hip and knee replacement patients, the rate of serious blood clots after surgery, and the rate of a wound that splits open after surgery on the abdomen or pelvis. However, Henrico Doctors Hospital is the same in its competitors in the C. diff infection rate, MRSA infection rate, and the number of deaths among patients with serious treatable complications after surgery. I wanted to thank you all for listening to my case study, and hopefully it shows you how the Henrico Doctors Hospital compares with its other competitors in Richmond, Virginia.